Guys, this is Dr. Sosnowski. I am here to go over your blood test report with you, your functional lab report, because I know it is a lot of information and everybody gets a little overwhelmed when they're coming in to see me, and I spend 30 minutes going over this alone. So I figured I'd go ahead and do this up front and make sure that you all had a little bit of understanding of what's going on. Obviously, I used a specific person's lab results here, so yours may be a little bit different, but this tells a lot about what I see generally. So I'd like to dig in and get going so we can get through this and not waste too much of your time tonight. So again, when we had talked at our wellness evaluation, we talked, and during our webinar, initial webinar, we talked about a functional lab range versus a standard lab range. So we base all of your results and all of your ideals based on that functional or optimal lab range. There's a functional lab range you will see here for every single lab test. And then there's a standard lab range that your regular doctor would use. So when it comes to cholesterol, your total cholesterol and your LDL are closely related. If the total cholesterol is high, the LDL is also going to be high. And if they're normal, they're going to be if one of them's normal, the other one's likely to be in the normal range. Cholesterol will be high for multiple causes. It'll be high if there's too much insulin resistance, you've been eating too many carbohydrates, or there's too much inflammation in your system. If there's diabetes, if there's any fatty liver disease, meaning you've eaten so much food over so long and your liver's dysfunctional and it starts storing fat for you. It'll also be high, cholesterol will also be high if there's any hypothyroid issues going on. Cholesterol is normal in some cases. It's also low. And we see that a lot less commonly unless you're on a statin medication. And then commonly we see the cholesterol being too low. Typically, if the cholesterol is too low, you're not making good brain cells anymore because the brain cells are made out of cholesterol. So you're not rejuvenating your brain. And you're also not making your hormones appropriately because all of your hormones are made out of cholesterol. And so you need those for that too. Your HDL cholesterol is typically low in somebody with insulin resistance and in somebody that has not been doing enough exercise, they're too sedentary, if there's metal toxicity or a number of other issues going on. So we see a low HDL commonly in somebody who's rather unhealthy or has a lot of insulin resistance or true diabetes already. Triglycerides we see as actually, let's go back to HDL for a second. The HDL will also be too high in the 90 to 100 range if there is metal toxicity or if there's autoimmune disease. So if your HDL is getting 90 or over, then all of a sudden it's not a good thing anymore. It's a bad thing. It's a sign that something else is going on that we need to address. So moving on to the triglycerides, we like the triglycerides in the 50 to 100 range. If your triglycerides are too low, it's a sign that you're not digesting proteins very well. You've got some liver toxicity going on, or some metal toxicity going on, or some digestion issues going on. High triglycerides are much more common, and they're typically insulin resistance, meaning you've eaten too many sugars over too long, and the insulin it gets ignored by the body, and so you have higher levels of sugar in your systems, and these create higher triglycerides, or you've been eating too many carbs and sugars in general. So they're a sign that your diet's not quite where it needs to be. The cholesterol HDL ratio and the triglyceride HDL ratio then is related directly to the level of the HDLs. So if the HDL is really low, then the ratio is going to be low as well, or the total cholesterol is really high or triglycerides high, these are going to be high. So treatment in general for high cholesterol is fish oil. So you typically see me writing for Ortho Omega, which is the fish oil that we use, very high levels of EPA and DHA, and I suggest 2 or 3 capsules a day. If I see triglycerides really low, or really high, I'm also going to be suggesting really cutting down the carbs and the sugars. Now, everybody, as they go through our program, is cutting down the carbs and the sugars. So I know cholesterol is going to come down naturally and triglycerides are going to come down naturally. HDLs are going to come up with 2 things. They're going to come up with fish oil, and they're going to come up with exercise. So those are the two things we want to see people do to increase their HDLs. HDLs can also be low if there's some heavy metal toxicity going on. So they may be one of many signs there that metal toxicity is going on in the body. Moving further, the hsCRP is your vascular inflammation marker. That's inflammation in the vascular system. So that's the stuff that can lead to heart attack and stroke. That's the stuff we don't want. I see that most particularly coming from dental or GI sources, and most particularly dental. Dental infections are a little known cause of actually heart attack and stroke. They're the biggest cause of heart attack and stroke because those infections in the teeth, either from root canals that are infected without you knowing it, or from periodontal or gingivitis, those bacteria are constantly getting in the bloodstream and constantly creating inflammation, which is really setting the stage for heart disease or stroke in the long term. So definitely something we want to get a hold of. So if I see a CRP that's high and it's not coming down, I'll be asking you to go visit your dentist or to get some kind of evaluation to make sure you don't have some ongoing inflammation and infection in your mouth. So we really want that CRP less than 1.0. Fibrinogen is a clotting factor and an inflammation marker. Ideally, we like to see it between 200 and 300. This one's just a touch high, so nothing I'm really too concerned about. When it gets over 400, you do have a really high risk of clots, and I will be putting you on a medication called Boluque to lower this inflammation. So hsCRP, fibrinogen are both inflammation markers, and there's also another inflammation marker down here called ferritin. And ferritin is an inflammation marker that's associated with an inflammation that I can't really explain exactly. I have seen it particularly high in somebody that's had radiation therapy in the past, as high as 600. So I know it has to do with dead cells, but I can't tell you exactly what that ferritin is. But when the ferritin, the fibrinogen, the hsCRP, any of these are elevated, these are our classic inflammation markers. We can also see elevation of the white blood count and a couple other ones that we'll talk about as I go further. Typically, if these are elevated, I'll prescribe a supplement called theracurmin. This is an activated form of turmeric that really is the most powerful anti-inflammatory out there for the body. So super important. Usually I prescribe 1 capsule twice a day. If things are really bad, I may suggest 2 capsules twice a day. If you're having a severe problem at home from something, either you ate something that really caused you a problem or you're having a lot of joint pain, you can actually take up to 3 capsules twice a day of the theracurmin. So next we're going to cover the homocysteine level. The homocysteine level is this guy right here, and most of you have probably never heard of it. Homocysteine is a marker for heart attack, stroke, and dementia. And when the homocysteine level is high, then you have a higher risk of these things happening. Now, I've seen levels as high as 26, and while I want them less than 7, a level of 9, 10, 11 doesn't really concern me too much, although I really want to get it down. But when I see a level of 18, 19, we got some big problems going on because you do have more risk of blood clots as well when the homocysteine is that high. So homocysteine is actually a marker for methylation. And I know most of you do not know what methylation is, but methylation is something that we do to some of our vitamins to make them useful for us. So how we methylate our vitamin B12 and how we methylate B12 and folic acid are particularly critical for our body and how it works, because we need methylated folic acid to make serotonin, which is our antidepressant hormone. And we need methylated B12 to keep our mitochondria from working well as a methylated folic. So methylated B12 and methylated folic acid are really, when we're looking at homocysteine, are really what we're looking at. How well does your body methylate B12 and folic acid? Unfortunately, the ability to methylate B12 and folic acid is actually genetic. You're either born with ability to do it well or born with ability not to do it well. The ability to methylate folic acid is a real issue Probably 60% of the population has a genetic defect of one gene in the ability to methylate folic acid. And so those folks need extra methylated folic acid to actually keep the homocysteine normal. Now, we also methylate DNA to turn it on and off and to prevent cancer. So methylation is really critical for way more than just heart disease risk, but it's also really critical for our ability to prevent cancer. So when homocysteine is high, the first thing I check is, do you have the raw ingredients? Do you have the do you have B12 and do you have folic acid? In this client, you'll see that the B12 is at 546. Now, optimal ranges are between 500 and 1,000. So 546 is just barely into the normal range. And in this person, folic acid is actually great. So we don't have to worry so much about the folate, but B12 might be a little bit of an issue. So typically when the homocysteine is low, or high rather, the first thing I do is prescribe a chewable methyl B12 methylfolate that actually has a high level of B6 in it, because B6 is our essential stress vitamin. Many people are low on B6, but we don't see a particularly lab test that tells us most of the time. So when I give that chewable B12, that's also methylated, and the methylfolate with it, that's all chewable. What I typically see is, because you're absorbing that methylated B12 and folic acid from your mouth, and it doesn't go through the gut, I see some really high levels of the B12 and folic acid in your bloodstream after this, and the homocysteine typically comes down to normal. If it doesn't come down to normal, the next time we do testing, we'll do some more further testing to see whether you have a particular issue with methylating folate or methylating B12. Vitamin D is the most critical vitamin that you can address in your health. Vitamin D is essential for the health of our bones, which we all know. It's also essential for the health of your immune system, which I think has gotten more common with the onset of COVID. But it's also important for our prevention of diabetes. It's prevention, it helps prevent cancer, particularly breast cancer and colon cancer. And is particularly important for our mood along the way as well. So vitamin D, we want between 50 and 90. And folks that have a lot of inflammation going on, particularly if there's obesity associated with the inflammation, we see an inability to get vitamin D levels up, and some people need really high levels. Typically, when vitamin D is low, in the 20 to 30 range, I'm prescribing 5,000 IUs of vitamin D a day, and that could be either in a liquid or a capsule. If it's in the 10 to 15 range, I'm typically prescribing twice that, or 10,000 IUs of vitamin D a day, until we get the vitamin D up to normal. Iron, really important for making blood and carrying oxygen in our system. The iron is typically low if there's a problem with stomach acid. It's not, or if there's been some bleeding somewhere along the line. So if iron is critically low, I'll typically ask you to do a stool guaiac test, i.e. grab a sample of stool the next time you have one, spread it on a little card, and we'll check it to make sure you're not having any GI bleeding. If the iron is mildly low, it's typically because you're not absorbing it very well. And that means you're either you're not eating enough food that has good iron in it, meaning meats, like vegetarians have more of a problem, or you're low on stomach acid, so you're really not digesting that iron. It's passing in one side and out the other, and so your iron is low. If your iron is really high, it's a problem with a medical diagnosis called hemochromatosis, or it's associated with inflammation. So when we see a high iron, I'm going to be looking at two things. I'm going to be looking at your TIBC, which is your iron binding protein. If your iron binding protein is high and your iron is low, it's doing the right thing. If your TIBC is high and your iron is high, it's inappropriately bonding iron and pulling it into the system. I'm also going to be looking at your transferrin saturation. This is the most accurate measure of iron storage. So if your iron is low and your transferrin saturation is low, you've been losing iron for a while. If your iron is low, but your transferrin saturation is still okay, then you've just recently been losing some iron. So it gives me a judge of how long this has been going on and how acute it is. If your iron is high and your transferrin saturation is over 50, then I know you may have a diagnosis called hemochromatosis. This is a genetic iron storage disease where you're storing iron inappropriately. Much bigger issue for men typically than women, because women bleed half their life with having their periods. So they have less of a chance of storing too much iron. But men can start having problems as early as their 30s by storing this extra iron in their heart, in their liver, in their kidneys, and other organs, and really cause failure of these organ systems. So hemochromatosis is a big issue, more so in men than in women. But if it is in your family, then, and we test you and find out that you've got issues with it, we'll be sending you to a hematologist to monitor that, and also ask that all of your family members be tested to make sure that if they have issues, they know it and they can get appropriate therapy for that. LDH, the ferritin is an iron storage marker, but it's also an inflammation marker that we just talked about a little bit earlier. Typically, the ferritin, if I see a low ferritin rather than a high ferritin, typically that low ferritin is an inappropriate low ferritin. Even if iron is low, ferritin shouldn't be much under 40. And that's an inflammation marker in the body that it's just not using iron appropriately. LDH is a liver enzyme, and we're going to switch and talk about the LDH with some of the liver enzymes on the next page. So I'm going to scoot down a little bit to the liver section here. The bilirubin, the ALP, ALT, AST, and GGT are some of our liver enzymes. The bilirubin is related to the gallbladder. So if the bilirubin level is high, there's often some liver issues. The gallbladder is not producing bile properly, or it's getting blocked. Or there's some metal toxicity going on. The ALK phos, the ALT, AST, and GGT can all go up when there's liver stress going on. So if alcohol in particular will raise the GGT, but the AST and the ALT will get elevated if you're on cholesterol medications, or if you've got a fatty liver going on. So there's various things. If your numbers are high enough in the GGT, the AST, and the ALT, I may ask you to go ahead and do a liver ultrasound, because I want to make sure that there's no liver tumors or no lesions in the liver that would suggest there's something more serious going on that we need to address. The alkaline phosphatase, if it's below 70, typically suggests some zinc deficiency or some vitamin C deficiency. So we address this separately with the gut section. Going to go back up to the top of the page here, and we'll discuss glucose and hemoglobin A1C. Now, the glucose and the hemoglobin A1C, if the blood sugar is low, the glucose, and the hemoglobin A1C is low, that would typically mean that you are not digesting, that you are not eating enough food or not digesting your food appropriately. In the case of glucose in particular, oftentimes if you have problems with your adrenal function, you have problems keeping your blood sugar stable. So glucose and hemoglobin A1C being low are something that I really like to make sure that is not happening, because a low blood sugar in the middle of the night will wake you up between 2 o'clock and 4 o'clock in the morning. And that's a sign that you're crashing in the middle of the night with your sugars. And so I will at that point suggest that you eat a high protein snack right before you go to bed. Avoiding doing intermittent fasting. So making sure you're eating 3 to 5 times a day rather than just 3 times a day or twice a day would be really important if you're having problems with blood sugar. If the blood sugar and the hemoglobin A1C, the hemoglobin A1C, by the way, is a 3-month measure of blood sugar. So it's what we use to classically diagnose diabetes. But anything under 5.0 would suggest that you're spending too much time in low blood sugar, in which case we need to address adrenal function, and we can also use a supplement for this called Proglyco SP that helps you balance your blood sugar out. And this is a supplement that you take every meal with your meals. The BUN creatinine ratios and the GFR are all associated. When the GFR is below 60, you're less than half of normal kidney function. And when it gets below 50, we start getting particularly concerned, because then you need to get followed by a kidney specialist on a regular basis. Increasing your water intake definitely increases kidney function. And for those of folks that have some issues with mold or Lyme and have difficulty concentrating their urine, I will often suggest an electrolyte mix at least once a day, if not twice a day, to keep the GFR in the normal range instead of getting too low. Sodium, potassium, the sodium-potassium ratio, the chloride, these are all related to adrenal function. So the health of the adrenals will determine whether these electrolytes go out of whack. If you are taking high blood pressure medications, some of the high blood pressure medications can cause a low or high potassium. So we'll also pay attention to that in this setting. CO2, it can be related to the electrolytes, but it can also be related to sleeping issues. So if the CO2 is high, can be due to low stomach acid. If it's low, as it is in this case, it can be due to sleep apnea or other breathing issues, as well as a B vitamin deficiency. In this case, this person has known sleep apnea, so I'm not surprised that the CO2 is a little bit low. When the CO2 is down and the anion gap is up, elevated above 12, that's a situation that we talk about as oxidative stress. Oxidative stress means that you have more inflammation in your system than you have anti-inflammatories. So your body is getting more and more inflamed. This is definitely not a good thing to have happen. And it is associated with a lot of inflammation in the entire system and as well as in the brain. So sometimes that's associated with an acute infection going on that uses up the antioxidants. Other times it's associated with heavy metals. If I see the CO2 way down and the anion gap up, I may suggest a supplement called H2 Absorb or H2 Elite. This is a little tablet that you put in water. It effervesces and releases free hydrogen into the water that binds up that inflammation and neutralizes it. So it takes it out of your system. What's really neat about that is that it actually gets through the blood-brain barrier and helps get rid of inflammation in the brain too. So really like that one. The next section, the calcium, the total protein, the albumin, the globulin, and the albumin-globulin ratio are things that we look at in terms of how the body is digesting some of the food. If the calcium is low, it's usually because calcium is attached to albumin, which is another protein in the system. And it's usually because we have a low stomach acid situation going on. The body is not digesting food properly because it doesn't have enough stomach acid. Total protein will drop with that as well, because you're not absorbing your protein that you're eating. In that case, your body is using your muscle mass to make new cells for you, because you need protein for all those new cells. So you'll see your muscle mass disappear as you see your proteins drop down lower and lower over time. You will also typically see the globulin drop lower. The globulin is your immune protein, but it's also a protein that's made by the liver. So if you're deficient in proteins, you're going to see the globulin levels drop. If the globulin level is too high, there's a lot of inflammation going on in the system. If the protein levels are too high, there's a lot of inflammation going on. It can also be some dehydration as well. So looking at the urine sample will tell me whether there's dehydration there. When calcium is down, total protein is down, globulin is down, the albumin-globulin ratio is up, and there may or may not be some zinc deficiency from a low alkaline phosphatase. This is really telling me that you've got a very low stomach acid situation. Now, interestingly, the albumin, which is another blood protein, will typically stay normal because the hormones in the bloodstream are attached to albumin to get to their destination. The body really strictly controls albumin. By this time you see albumin going below 4, you've got a big problem going on. and something that really needs to be addressed acutely because their body's not going to be working well. The hormone levels aren't going to be normal. Along with these going low with low stomach acid, we typically see iron drop low, B12 can drop low, folic acid can drop low. We also see magnesium dropping low with this. So all of these deficiencies can be caused by poor digestion and low stomach acid. Going on to the third page here, we're looking at uric acid. A high uric acid can be associated with gout and is typically associated with eating too many fruits and carbohydrates or a lot of inflammation in the body. You typically see uric acid being high when there's diabetes going on or a lot of insulin resistance. Again, low magnesium is something that we see typically with low stomach acid. We can also see it in a more normal situation just because magnesium is not as, food that we eat today is not as high magnesium as it used to be 20 years ago because of the way that we process our food and the earth that it's grown on. So thyroid, your TSH, free T3, free T4 is really what we're judging thyroid production on and thyroid function on. Your pituitary puts out TSH to tell the thyroid to produce T4, and then the body changes T4 into T3. So it's TSH to T4 to T3. The T3 is the active thyroid hormone. So I'd like to have the TSH less than 2.5 ideally. I'm okay with 3.0 in some circumstances. I'd like to see the T4 higher than 1, and then the T3 somewhere around 3, ideally. If the T3 is low and the TSH is high, then I know you're hypothyroid. Or if the T4 and the T3 are low and the TSH is high, I know you're hypothyroid. And then we need to replace the thyroid hormones. Oftentimes T4 looks good. TSH is equivocal, but the T3 is really low. And that's because the body has so much inflammation going on that it's unable to change T4 to T3, in which case we have to support the T3 for a while to keep you from gaining too much weight and from feeling too fatigued, as well as to help the body continue to process better while we try to work on the inflammation. Your thyroglobulin and your TPO antibodies are antibodies against the thyroid. So this is a marker for autoimmune disease of the thyroid. And we check this because it's so very common in our population today. This person has no issues with that. The white blood count is another marker that we look at closely. If the white blood count is high, above 7.5, there's a lot of inflammation going on. If it's as low, below 5.3, it's often compatible with chronic mold illness or chronic Lyme disease. So if we see this, and I think there may be symptoms that are compatible, I may ask you to do what's called a Sears panel or chronic inflammatory response panel to see if you have the genetics for chronic mold or chronic Lyme disease, and then to actually see if you've got some inflammation markers that are compatible with that. So do you have the genetics, and do you look like you've been hit with one of those that is affecting you? Looking at the red blood cell count, the hemoglobin, and the hematocrit, these are your blood count. And the red blood count is your actual blood cells. The red blood count will go up when there's low iron and low red hemoglobin and hematocrit, because it's trying to make up for the low iron count and the low hemoglobin hematocrit count. It will also go up along with the hemoglobin and hematocrit when there's sleep apnea going on. So this person has known sleep apnea, but it obviously is not well controlled, because when the body is seeing oxygen deprivation, like when you're going to altitude, the first thing it does is makes more red blood cells to carry more oxygen. In this case, in the setting of sleep apnea, if you're not at altitude, but you're still getting low oxygen, your body makes more and more red blood cells, but it's not helping to carry more oxygen because it has nothing to do with actually the oxygen in the air. It has to do with the oxygen that you're allowing in your lungs because you're not breathing well at nighttime. So we can typically follow that with the red blood count here. And if I see this and you don't have a diagnosis of sleep apnea, I will typically suggest that we get a sleep study to determine what's going on further. A high platelet count will typically suggest a lot of inflammation in the system. A low platelet count suggests some autoimmune disease of the platelets, abnormal clotting disorder. Usually it's just mildly low and something we can just follow. If it's really low, 20,000 or less, 20 or less, then that's a case where we'd be sending you to a hematologist to figure out what's going on further. Your MCV, your MCH, your MCHC, and your RDW. I promise you we're almost getting to the end here. These are the sizes of the red cells, different ways of measuring the sizes of the cells. And these levels can be high if there's B12 and folic acid deficiency. They can be low if there's iron deficiency, or in the case of the RDW, you can have both of these to make this even higher. You will also see these get elevated in heavy metal deficiency, heavy metal toxicity. So the MCV, the MCH, and the MCHD can all go up with metal toxicity. Sometimes you see them together and sometimes not. The last little part we're looking at down here, the neutrophils, the lymphocytes, the monocytes, the eosinophils, and the basophils, are the different types of white blood cells. The neutrophils are the white blood cells that attack inflammation. The lymphocytes are the ones that attack viral infections. The monocytes are the ones that help with chronic inflammation. The eosinophils help with parasites or allergies. And the basophils are typically elevated in some heavy metals. So these are also a sign of other things going on in the body that I'll take a look at and know that I have to address. There's nothing I can do to address these in specific other than the causes that are causing them. We do address the hormones initially on the salivary hormone test, but in follow-up, I put them here because for the men, because occasionally we'll do these in follow-up if we were using testosterone replacement therapy of some sort. So I hope that gives you a little clue about the things that I'm looking at. Obviously, we'll talk about your testing a little bit more in specific, but you may need to listen to this 2 or 3 times to actually figure out everything that I'm saying and remember some of it, because it's an awful lot. But this is going to be your template going forward. The second set of labs will go on here. The third set of labs will go on here if you work that long with us. And then this will be your template going forward. After you're done with us, working with us, if you're getting further lab work from another doctor, you can put it on this graph for yourself and actually figure out, hey, how am I doing? Am I doing a good job, or am I getting worse along the way? Do I need to see that Dr. Sosnowski back and get myself back on track? So I hope this was really helpful, and I hope you have a fabulous rest of your day, and look forward to seeing you for your lab results and seeing what you yourself have going on. Thanks a lot. Bye-bye.